In the literature, I can find a research article from 2015 that looks at data on specifically the MMR vaccine and injuries from 2003 to 2013, so a decade. In a decade, there were about 3,200 injuries from this vaccine reported in the system. Most of those reports, 82% of them, were reported by a physician. 7, which is less than 1% of all of those injuries, it's less than 0.5%, were deaths. 18 of them had severe complications that were not death, and 113 pregnant women in that time were vaccinated in the first trimester, not knowing they were pregnant. 40% of them had reported an adverse event after that particular vaccine. What do I think about the current state of things in Texas? Everyone has a choice to make. You may not agree with that choice, but it's really none of your business. Your right to parent and protect your child is your right. My right to parent and protect my child is my right. My right to make my own healthcare decisions is guaranteed in the Constitution. I am not guaranteed healthcare, but I am guaranteed to make my own healthcare decisions in the Constitution. Other research surrounding the measles virus. It is a virus. It is a virus that spreads very similar to how the flu spreads, and in fact, a lot of people mistake measles symptoms for being the flu and never get their kids tested because it looks very similar. It can also look like mono or Epstein-Barr virus. It can look like parvo. It can look like roseola. It can look like hand, foot, and mouth disease. There are a lot of things that the measles virus looks like and can be mistaken for. It spreads by cough, sneeze, spit, just like the flu. There is an increased risk of having an adverse event to a vaccine and also an adverse event to the virus if you already have a compromised immune system or specifically a vitamin A deficiency. So if your child is somebody who doesn't like to eat a lot of different colored fruits and vegetables, your child is more likely to contract measles and have complications. If your child has an autoimmune disorder or you have an autoimmune disorder, your child is at a higher risk for having an autoimmune disorder because something in your environment probably triggered yours, because that's 95% of all autoimmune disorders. And that means that something in the environment could trigger your child's, which means they are at a greater risk. Knowing and understanding the risks is part of helping you work with your child to make sure they stay healthy. One of the things you can do is make sure they have a good balance of vitamins and minerals. You can make sure that they have great gut health. You can make sure that you're feeding them good food. One of the biggest things that was a resultant in death was literally a food desert, and not a food desert like in the United States, like food deserts that happen in third world countries where there aren't any nutrients available other than rice. It's devastating for someone to lose their child. Devastating. But that parent's right to not vaccinate their child was their right. And that comes just like driving a car with inherent risks.